Good afternoon, and today we have a pleasure of interviewing Dr. David Alfi. That's actually first oral surgeon who helped people sleep and breathe better on our channel. Good afternoon, doctor.
Good afternoon, Maria. Thank you for having me.
And this is a super lucky opportunity because this type of treatment, a lot of patients looking as a magic wand. So I do this procedure and now I don't have to wear the CPAP, wear the oral appliance. I don't have to, lose weight. I don't have to think about Inspire and a lot of other things. So that's going to happen. We're going to find out how it's going to happen. So, first of all, thank you to our listeners. If you have trouble sleeping or sleep next to the snoring partner, this program is for you because Dr. Alfi will tell us how you can sleep, in the best restorative way after the surgery. And if you're a medical professional who, just like us, trying to put all puzzles of this, disease of evolution together, this program is for you because this might be a missing piece of puzzle in your toolbox. Yeah. So I'm gonna first introduce Dr. Alfi to our audience. Just like I mentioned, he's oral and maxillofacial surgeon who graduated from his program in Columbia Medical and Dental School. That's a combined MD DMD program, and he's a pioneer innovative surgeon who actually come up with that revolutionary technique, and he does the surgery totally, right? 1 hour, the whole orthognathic surgery is 1 hour due to his technique, but also it's eliminate need for braces, wires, Foley catheters, and guarantee faster and smoother recoveries. And he's actually, I put it in his name, he is a surgeon for sleep apnea, oral surgeon for sleep apnea, but also he does, cosmetic, let's say, they all connected to airway, but underbite, overbite, facial asymmetry, provide both health and quality of life to his patients. So my first question to you, I'm going to start from the business. How do you determine who is a good candidate for orthognathic surgery for sleep apnea? Because if we consider the statistic, and I can say it's true in my practice, from 10 patients, 2 of them have sleep apnea. How you determine who you will be able to help?
Yeah, so that's a great question. Thank you for that introduction. Before I answer that question, I like how you said for not only people with sleep apnea or people that snore, but also for partners of people that snore or have sleep apnea, because secondhand sleep apnea is a real thing.
And they get depressed. It's absolutely scientific proof with people who sleep next to the snorers, they get into depression. But, I think it's such a direct connection, we don't even have to explain why.
Yes, I agree. So yeah, who's a candidate for jaw surgery for sleep apnea? I think everybody's a candidate. I know that sounds a little abundant, but I think that it's true. I do think, and candidate might mean different things to different people. When I say candidate, I mean that everybody could benefit from jaw surgery and could consider it. I know you said that 2 out of the 10 patients you see have obstructive sleep apnea. I think you're being, very conservative with that number.
But it also depends on geographic point, because what I learned from statistic in Germany or in Japan, it's 50%. So it means from 10 patients, 5 of them.
Yeah, definitely. And I think that the way we look at medicine too, here in the United States, is a very end-stage disease approach, meaning that, we look at people if they have diabetes or they don't, or they have high blood pressure or they don't. But in reality, everything's a spectrum. And you don't just have end-stage sleep apnea overnight. A lot of people have airway disorders, that are related to their jaws, that are able to compensate and not obstruct when they're younger, or when they're able to compensate because of different mechanisms, and then start to develop more symptoms and then get a diagnosis later in life. But the reality is that there's somewhere on that spectrum, even from childhood. So I think that as we learn more about jaw surgery and sleep apnea and the epidemic of everybody having small jaws, which I think is true.
True.
That we're going to have better ways of saying who has, risk factors for end stage sleep apnea, but also, where can we get these people early before they develop the end stage and anxiety, depression, high blood pressure, all the things that come with poor sleep and sleep disorder breathing. So I think when I think about that question, I think first of all, who's at risk of end stage disease at some point in our life, which we want to avoid because it comes with so many morbidities. And when you look at who's at risk, we know that most obstructive sleep apneas are from the upper airway, and the upper airway is really the jaws, the upper and the lower jaws, right? And affected by the tongue, of course. You need that tongue space. So it's almost as simple as thinking about who needs braces and who needed teeth removed, even wisdom teeth, because we should have room. We should have room for 32 straight teeth, right? And by definition, if somebody does not have room for 32 straight teeth, meaning that at some point they were recommended braces because they have crowding, or they were recommended wisdom teeth removal because there's no space for them, those people are at risk for end stage disease at some point of their life, because it's not only the teeth we don't have room for, it's also the tongue and the nasal anatomy. So I think that number is 10 out of 10 for candidates for jaw surgery. I think the reason that that's not popular yet is because traditionally jaw surgery is terrible, and the risks did not outweigh the benefits of doing surgery, even the way I learned how to do it and how it's still done in most parts of the world, because it used to be a very difficult operation. It still is for a lot of people around the world that don't have access to the cutting edge protocols and techniques that we have now. People were wired shut. The surgeries were 6 to 8 hours. The recoveries were difficult. The results were not predictable. Complications were high. So it's not something that we even really thought of or still think of in the mainstream as a great solution, even though we knew for a very long time that it's the best treatment for obstructive sleep apnea and the best chance for cure. Like you said, get off of CPAP, get off of appliances, but also get off of blood pressure medicine, anxiety medication. There's so much potential for making people healthier and better. But until recently, it wasn't a real good option. And even though it's a great option now in the right places and right surgeons, it's not really known yet. It's not mainstream. But the truth is now we can do it in an hour on average. Not every surgeon is there. Very few are, but they're getting there. And with the custom titanium guides and plates with 3D digital planning, they're much more predictable, stable. People are not wired shut. We can do it with Invisalign. We don't need to do it braces. And people are back to work in a week or two. And then most of these patients are getting rid of their CPAP, getting rid of their appliances, but also coming off a lot of medicines.
That's a beautiful story. You painted in a very bright color, but I'm going to ask you a tricky question, doctor.
Yes.
What is expiration day for orthognathic surgery? We are human beings, and yes, I understand we, with the orthognathic surgery, you move the jaw forward, but what about the tissues? It's not always, like let's say skeleton. It's not always a frame. It's also soft tissues for us modern human beings. Might not be toned enough not to collapse at night. I heard, and I am going to get, I'm sorry to interrupt your answer. I heard about 17 years or 13 years for orthognathic surgery. That's the expiration day. What's your opinion on expiration day for orthognathic surgery? Because for people who take this, step, I want them to know what can happen even in that long period of time.
Yeah, so definitely two ways to answer that. One is expiration and, who's a candidate for it. At what age should you do it by? The sooner the better. The reason the sooner better is because, one, to get healthier, better, avoid complications of poor breathing and sleep. But also the sooner, the healthier the patients are able to recover and have less risk factors. However, we have patients that are even in their 50s, 60s, that go through surgery successfully and are healthy enough to do it. But it becomes difficult the older we get, and there's more risk factors because a lot of these patients have already developed heart disease and lung disease and other organ damage, especially because they've been dealing with sleep apnea. So expiration, no real expiration. It's an individual thing. It's based on risk benefits, like every surgeon has to weigh when we decide on surgery. But in general, the sooner the better. However, everyone's still a candidate. The second thing, I think the question you were alluding to is, if we do orthognathic surgery on someone, how long do we expect those results to be good? I think the answer to that is forever. There is no real expiration. And what I mean by that is that when we move the structure better, it's going to allow more space for the tissues. So yes, if somebody gains weight, I've had patients that had success and then they gained 20% body weight and fat, and now they have sleep apnea again. Well, of course, the tissues are going to cause a problem. However, even in those patients, because their structure is more forward, they're much better than they would be had they not had the surgery. Meaning, had they not had the surgery but still gained that weight, they'd be in a much worse shape. And the same goes to that aging. So if someone had surgery 20 years before, or now you're 20 years down the line and the elasticity of the tissue from aging is not as good, it is possible that snoring comes back, some sleep apnea starts to develop. But at that point, not only was that 20 years much better, but they're in a much better place than they would be if they not had that structure.
Then my question, I have two questions in mind. They're so sharp, but I almost want them to ask at the same time. So my first question to you about MARPE. Orthognathic surgery, if we're being very technical, it moves the jaw forward. Of course, you have opportunity to do, expansion. So what's your view maybe on sequence of treatment if me as a provider who, discuss the treatment options with the patient, we're talking about, some people say, oh, MARPE gonna do the miracles and you don't need orthognathic surgery. You're gonna get, broader nose and you're gonna breathe better and you're gonna have, bigger jaw. Sometimes those words are not super true because I've seen people coming to me after MARPE. But I want to ask you, do you recommend people to have MARPE first, what they have a horizontal development of the jaw before they proceed to orthognathic surgery? What's your view? And then I'll ask you my very hard second question.
Awesome. That's a great question, especially because MARPE is becoming such a popular tool that a lot of people are learning to offer. And a lot more people can offer MARPE than surgeons can offer MMA, meaning there's way more providers that are able to do MARPE than there are people like me out there that can do an MMA. So that there is an access component to that, right? Yeah. So definitely, the truth is that most people are small in the transverse dimension and in the forward growth dimension. It's both, right? I have really never met anyone that needs expansion that doesn't need to also come forward, right? They go together because it's three-dimensional.
Of course.
So yes, I think MARPE is a very good tool, especially because there's access to a lot of providers all over the country that can do it, and people are getting better at it. Their custom protocols and ability to customize the MARPE devices are making it more predictable to do and to do safely. So it's a great tool. But it's not, it's going to get someone better, right? It's definitely going to help with tongue space and it should help with nasal airflow. But where does that fall along the spectrum, right? It may, for sure, it's better than not doing it, but most patients will still benefit from coming forward, and it's just that how much do you want to optimize somebody? Now, there are a lot of patients that need a lot of transverse expansion that can't be done with Invisalign or braces, especially they might be in crossbite, and they need to come forward. I think that in those cases, I recommend doing MARPE first to get transverse enhancement, and then jaw surgery to come forward. That's ideal. Obviously, you know, there's downsides to that, meaning cost, time, and time into treatment, but that is what it is, right?
And my last question to you, doctor, what if, somebody does MARPE and then orthognathic surgery, but sleep apnea not resolved fully? What are the, not next step in treatment, but, me as a provider who kind of, guide, let's say,
Sure.
people through different options, I want to present all the cards prior to the referral. I want to be as professional, especially for my listeners as well, who are listening and maybe considering, okay, I'm going to go through all these steps to get healthy, but what treatment can I use if MARPE and MAA not going to fully resolve my sleep apnea, symptoms?
Sure.
Which is also realistically possible, and I met people like that. What treatment they allow to use?
Yeah, so it's a great question, and it's a real question. But something that, if someone has had a MARPE and jaw surgery to come forward and they were both done successfully, the sleep apnea is very multifactorial, right? Like we said, weight gain is a big thing, right? A 10% increase in weight gain is a 6-time increase in obstructive sleep apnea risk. So, for example, someone I can widen this much and bring them forward to New York, and if they gain enough weight, it doesn't matter. They're still going to have sleep apnea, right? And like you said, aging and soft tissue, tonsils, there's a lot of different things, tongue size, there's a lot of different components to that. But even in these patients, it's not a failure or to be discouraged, because had they not gone through those things, they would be much sicker, much worse off. So even in these patients where they might still require CPAP, their settings are going to be a lot lower than they would have been. Their symptoms are going to be a lot better than they would have been, and their health is a lot better. But to answer the question, what can be done if someone wants to keep going, try to get to that optimal 17-year-old healthy breathing jaws from 1,000 years ago? What can be done? Things can be done. One, you got to look at it holistically. So is the person drinking alcohol? Alcohol is terrible for sleep and soft tissue, sleep cycle, but also muscle relaxation. So what are they doing with their habits? Like, I cut out alcohol completely, right? And people have to learn to take responsibility with their health too. There is no magic wand. Everything is a tool, and you have to do everything you can. Surgery is one powerful tool, and we're able to get a lot of people off of medicine and a lot of people off of CPAP and appliances. But if they're drinking alcohol, they're not eating clean, they're not exercising, they're not meditating, they're not doing all those things, then you can't expect to have ideal miracle benefits, because the truth is that you have to take accountability for those actions as well. So the first thing is look at it holistically. What are the parts of sleep hygiene? What does diet, exercise look like? What does metabolic health look like? Working on all those things. Then if that's all good, then we start to look at what other treatment protocols can there be. There can always be revision surgery. Sometimes we move someone forward 10 or 20 millimeters, but because of their soft tissue, they need more, right? And then if they're up for it, then a surgeon can bring that jaw more forward, for example, or wider. That is definitely an option. Although most people want to avoid going through repeat operations, that is a possibility if that's what they're trying to aim. There are other things like CPAP and appliances that
Can they wear appliance? Can they wear appliance after the surgery, or it's not recommended? Or after the surgery, you have to accept the CPAP?
No, they can wear appliances still. Once they're done with their ortho treatment, and they've recovered from surgery 3 months later. An appliance is definitely still an additive tool. CPAP is an additive tool. There are things like Inspire, which stimulates the tongue, which I don't love, but it is a tool, and all these things can be looked at based on the individual factors.
Got it. Thank you very much. That was very clear and very valuable. And I really hope people who are listening to us, they add something else to the toolbox with a realistic expectation. I think that's most important part of this interview. It has to be realistic expectation. And then after the treatment, you will feel better.
Yes.
Thank you.
You
can follow it also. You can follow Dr. Alfi. He has a podcast when he talk, interview a lot of specialists. He's in the process of writing the book. You can find him online, and he's also very popular on the Instagram with his before and after treatment. So thank you very much, Dr. Alfi, and I hope my listeners find you and find out things what can make them feel better, like they satisfy the curiosity and interest toward this modality of treatment.
Yes, thank you so much for being a voice for such an important problem, and really something that's not mainstream but should be. So hopefully your work is, I know it is, contributing to that and make people healthy.
Thank you.